Hello, everyone, and welcome to the Digital Health Wire show. Today, I'm excited to be joined by Dr. Ankoor Shah, who is the VP of Clinical Excellence at Included Health. Ankoor, it's great to have you on the show today.
Thank you for having me.
So, Ankur, I've heard Included refer to itself as the all-in-one personalized care platform. All-in-one is a term that gets thrown around quite a bit, but you guys really seem to live up to the title. Can you walk us through what goes into being an all-in-one personalized care platform and what are the different components there?
Definitely. And I think as I think about myself as not only a practicing pediatrician, but as a patient, as a person who's trying to navigate this healthcare system and what I want care, I want access to care, I want answers to my questions, and I want advocacy, but also I want it when I want it, where I want it. I want it hassle-free, and I want it super personalized and tailored to me. And I'm a very demanding consumer, and I think we all should be. And that's really our mantra. Well, how do we answer all those questions as well? So when I think about when we want care, so Included Health, as you said, is a personalized all-in-one healthcare company. Which means 24/7 serving millions of members across all 50 states. And for the when, it really is whenever you want care and where you want it. So whether it's virtual or in person. So our virtual care services, for example, we have virtual urgent care, virtual primary care, virtual behavioral health, including psychiatrists and therapists. And we're expanding really significantly into specialty care as well. When I think about hassle-free, I want a seamless experience. I don't want my medical care to be in one bucket and then my answers to my bills to be another, and then this kind of coverage or administrative burden to be in a third. Well, what we have is a fully integrated platform in which I get the answers to my financial questions, my coverage questions, and then also care and case management, in which we have not only nurse care managers, but then social workers, dietitians, physicians, all working to figure out what's best for me and my care plan as well. Including even expert medical opinions. If I have back pain or if I'm thinking about surgery, I kind of want a second opinion as well from the best institutions in the world. That helps me have this hassle-free experience. And then lastly, I do want it tailored to me and what our platform does and what actually, we talk about platform, but it's all the people behind the platform. The physicians, the clinicians, and all our member care advocates is we get to know the individual. For example, one thing we do is we ask periodically in the last 30 days, how many days have you been healthy? And that's our marker. Let's try to improve your healthy days. And then we personalize different matches for you, whether it's in-person care or virtual care as well.
Perfect. So if I'm an included member and I've been healthy 29 of the last 30 days, but I wake up on day 30, I have a little bit of a cough, and I want to see a doctor in some capacity. How do I enter the ecosystem? What's that experience look like for me? Do I use an app or how do I kick that off?
Yeah. So it's really that answer around how you want to access care or how do you want to access Included through the app or through calling, any way that works best for you. We kind of model around your experience. But say exactly, you're not feeling well and you want to have access to care and you want to get care. Well, we could get you a virtual urgent care appointment immediately through our app. So that's, option number one. And actually, this idea of clinical excellence and in urgent care, what that means is, are we actually solving your problem most of the time, as opposed to going to virtual urgent care and then having to go to brick and mortar? And over 90% of the time, we actually solve your immediate problem, which is quite wonderful. But say, I actually want to be seen in person. The quality of docs you see, if you were just to Google or go down the street, it varies. You have no idea if this doc is really going to be good for the issue that you specifically have. And this is where we help connect you through our provider match to a clinician that really matches your specific need that we know is high quality as well, that's been shown to improve outcomes and reduce costs. So whichever way you want care, we just make it seamless for you to get it.
It really seems like you do lean in on also the advocacy component, like being in the patient's corner. If after my appointment I get it like an unexpected bill from somewhere, I'm looking for someone to be on my side, is that through the same interface? How do I get involved with
It,
that?
exactly the same interface. And I'd love to actually let's come back to the interface part as well. But exactly the same interface. Um, we have all your claims. So we have claims data, your electronic health record information, as well as we know your plan and policy, and we're connected to your health insurer as well. So we really can be your advocate because we have all that. But one thing we don't do is we don't do utilization management. We don't do denials.
Mhm.
So we really are in your corner, and you just send us the bill, take a picture, send it to us, and we'll take it from there. And most of the time, we've saved hundreds, if not thousands of dollars for the individual member. Um, and no other kind of group, if you're a provider group or a payer group or a health insurer group, there's not really a financial model to save out-of-pocket expenses for the individual patient. That's why we believe there has to be this third way in which we just are relentlessly focused on the member experience. And then everything else will kind of work itself out.
I love it. I love it. Leading with the member experience is a good North Star to have there.
Yeah.
Yeah, no denials. I bet that's ringing true to your members' ears, in this day
Yeah.
and age. I bet that does feel
It
like you're in their corner.
it really does. We our brand, we're really proud of our brand because we have such higher engagement compared to even other competitors or healthcare insurance carriers as well, because of that member trust as well. So when we sometimes also have member services. So we're the number on the back of the insurance card that as the first gateway into helping a member out. And when our large purchaser groups make that arrangement, the members are just so excited because they know they're talking to an advocate first. And we have better engagement and we actually kind of help them get the right care at the right place without even worrying about prior auth or denial in the future.
Perfect. So we're tracking the engagement. What else goes into clinical excellence? How are
Yes.
we keeping eyes on, are we living up to providing clinical excellence? How are we reporting that to our customers and to our members?
Mhm. I really love the term clinical excellence because I think one thing that differentiates included health is this relentless focus to move from good to great. I think a lot of people could get fairly good with different products, but it takes about three times as much effort and money to get to great. And that's where we think our sweet spot is. So when I think about clinical excellence, what that means from good to great is in our clinical teams, I don't compare us to virtual care companies. I compare us, and we built our clinical practice modeled off of Mayo Clinic, modeled off of Cleveland Clinic, Mount Sinai. We saw how they structure their practices, and we built the same way. For example, they have employed physicians. We have employed physicians. They have a robust safety and quality team. We have a robust safety and quality team. They do a lot of research. We actually publish significantly and do academic research. So our modeling is different than transactional care to the best in class care. And then you said, well, the proof is in the pudding. So what does that show me what that means? And I won't say it. I'll give one of our clients, Walmart actually said this, one of our largest clients, that we reduced their members' hemoglobin A1C by 24%, a 26% in readmissions, and 11% reduction in costs, their total cost of care. So what I love is just having our clients tell us the results as opposed to coming from us.
Mhm. Yeah, you said one of your largest clients was Walmart. I don't know if the clients get much bigger than that one. Yeah. How long have you been working with Walmart and how did that partnership originally stem from?
You know, so we've worked with Walmart for multiple years, but what's wonderful about the Walmart relationship is the innovation that's going along. So it really did start off, with a singular service, and then we've grown into all-included care, which means we have all of our virtual care services, all of our navigation services, and really taking care of the full member.
Mhm.
Uh, and in that innovation journey, this is one of the areas where we're thinking moving forward, how do we get more involved with making the member's journey easier. And the hardest part is if you have complex medical needs, you likely have complex healthcare financial issues and administrative burden as well. And these individuals need a lot of support. And we're the first to say virtual only is not going to cut it. Those who are virtual only and sticking in that space are not geared for the future. So with Walmart, we're piloting new ways of delivering care in person for most complex members
Mm.
also, which is really exciting.
And last year, I know another big milestone was you moved into specialty care. So you're already doing the primary care, the behavioral care, all that is integrated, and we're now moving further into specialty care. How has that launch been going, and why was that important to bring into the platform?
Yeah. So with this relentless focus on the member experience, where is there friction and hassle, and where have we solved it? So we feel we've solved it for a lot of the access, a lot of the advocacy, a lot of the answers as well from the single platform. But you get a lot of hassle when you get to specialty care. And that's where patients and members are the most vulnerable with the cancer diagnosis. Imagine, I know I have family members, I've treated families with cancer. The oncologist is just one part of this whole ecosystem of your life that's turned upside down. And you need support 24/7 from all different types of people, from palliative care, from financial advocacy, from just care groups as well. So what we realize is that's an issue with the member's experience that's causing a lot of friction. Let's solve for that. And that's exactly what we did with our cancer clinic, is making sure that everything they need, not just the cancer, not just the chemotherapy or the surgery, but everything that wraps around it is as seamless as you can be. And then also for your cancer, for your chemotherapy and surgery, are you going to the best place? Is there a place, is there a center of excellence that actually has better outcomes? There's an information asymmetry we all have. We try to reduce that asymmetry. So that was with their cancer clinic. Same thing, similar with our Center for Metabolic Health as well.
Mhm.
How do we make things seamless?
And what were some other big milestones last year outside of that big push? Were there any other notable partnerships or anything that our viewers should be aware of?
Yes. So what we're most excited about this that was launched this past year was our CalPERS relationship. So CalPERS is the California Public Employees Retirement System. It's one of the largest purchasers of healthcare in the nation. Uh, and they feel what many of our clients feel, a rising cost trend and frustration that we've been doing the same things and it hasn't been working. And their members are saying things aren't, why are we doing the same thing over and over again? The same reason I got into healthcare is and why I joined Include Health, we have to do something different. So they partnered with us, and we're partnering with Blue Shield of California as well to really say, let's take care of the full population. And this is what's exciting. We're on the hook for quality outcomes and cost. So that idea of moving away from transactional care, we're counting widgets and fee for service. We believe that this third way of healthcare is a way to make people healthier and reduce healthcare costs. And we're putting our money where our mouth is. And by money, it's about nearly $500 million fees at risk.
Mm.
And the goal is by 2029, we reduce our cost trend to 3%.
Mm.
By the way, other employers, if you look at where their cost trend is going in 2029, it's about 8%.
Mm. What other metrics do you use to kind of guide care delivery and make sure that you're on track to hit these different milestones? What are your North Star metrics that you use to focus in on?
So when we talk about value-based care and especially cost trend, you quickly jump into two camps, and these are the two camps people don't talk about. So we'll give it a little inside baseball right here. One camp is let's reduce access to care by creating different protocols, and that's way we reduce cost. That's traditionally, people could dress the Christmas tree in a different way, but that's a lot. You could when you look under the hood, that's what they're doing.
Mhm.
The other way, our way, is saying if people are healthier, they are actually going to have less costs because we're catching illness and disease early and we're treating it so you're having less high cost utilization and better overall quality of care as
Mhm.
well. So when we have that methodology, it's really primary care access, so connection, primary care access, specific quality measures across chronic disease, and then including very specific illnesses that affect families the most. So cancer to certain musculoskeletal injuries, for example, really understanding how do we make sure we're in a preventative mindset and then meeting specific quality metrics along that. But our North Star, because you could probably see it gets pretty confusing pretty quickly. You got 100 metrics. Our North Star is healthy days. What we found is if we improve your overall healthy days, it's because we've solved a lot of those quality metrics and it actually is going to result in reduced cost of care. So that's our North Star. Are we providing more healthy days to you? And talk about an easy way to talk about healthcare quality for once.
Mhm. And looking ahead to maybe just this year, we're improving members' healthy days. What are some other big milestones along that journey of making our members more healthy? What can we look forward to from Included this year?
So a deeper dive into specialty care, um, pharmacy is what we're really excited about because one thing that we all hate is there's a different silo for whichever part of care. Last time I checked, your pharmacy, your medicines are part of actually how you get care delivered. So why is it in a whole separate bucket, a whole separate portal? Our goal is to integrate the pharmacy experience to make it seamless and that you're in the driver's seat. Do you know there's a lower cost option? Does your provider know? There's a big gap in that space in which we feel we can really kind of connect everyone to, and then really engaging more creatively and thoughtfully in-person care. Um, we want to be part of the full healthcare experience for our patients and members.
And working in the employer space, what are some of the big trends you think are going to be important to either keep an eye on or make sure that are at your back supporting you throughout the course of the year?
The largest one we continue to see is point solution fatigue. How moving from funny numbers to hard and true cost numbers. So let me tell about both of those. Point solution fatigue is there's a nice solution for a very specific part of the population, but if you have a PEPM type of payment model, it's very hard to see a ROI, and it's really not member centric to have 20 different point solutions for that you're navigating as a benefits leader as well. So the real push is, well, how do we have one solution that integrates everything? Or if you have multiple point solutions, what's a single portal that connects to that? The second around funny numbers is every company you talk to will say in their own internal accounting, look at this, look how good we are. The way we think about it is let's have our clients tell us what the results are and let's get out of all these intermediaries. Let's talk about total cost of care and let's talk about overall health outcomes. And let's put our money where our mouth is. And we're seeing a lot of employers starting to realize that's if that's our ultimate goal, let's find a partner for it. And the last, I know I said two, but there is a last one. It's about I'm hearing a lot about trust um, and engagement. There's a real concern around healthcare ecosystem, whether it's with carriers or even hospital systems, that a big way of or disengagement happens because there's lack of trust. And they're looking for a partner to see who's looking out for my member.
How do you build trust? How do you communicate that to an employer when they all say I can trust you? That no one is walking in and saying you can't trust me.
Yeah.
How do you prove that trust and how do you like really build that relationship?
Yeah, it takes hard work and a member first centricity. So it's really about how you design your product. I'll be totally honest. If you design your product to have more clicks, or you're trying to steer access of care to reduce cost, if that's your goal, if that's your problem statement, you're going to deliver a product that does that. And what that means is you might actually think about an offshore model for your care advocates. You might use AI for 95% of the time. Another example we see with our competitors, so our care and case management, we have advanced practitioners. So we have a doctor, NP, or PA part of care and case management. Others just use nurse protocol because the problem they're trying to solve is around cost and checking a box. But if the problem we're trying to solve is excellent member experience, then you just design things differently. You design programs differently. And then you just see, and then the proof comes when people interact. Our repeat engagement is incredibly high. So we keep on having repeat engagement. You're right. Getting through the front door for someone who doesn't know included health is always going to be a little bit of a challenge. But after the first interaction, what we think is our success is repeat engagement.
Mhm. No, I love the member centricity. It's really shining through as like a core focus there. It's very Amazonian, like fewer
Yeah.
clicks, members first, get the experience correct, the rest will
Oh,
follow.
I would love to give you an example about that,
Please,
actually.
please.
Because this goes to this idea of good to great, in which it takes so much effort to get to great. So as you go see your doctor and then check out your labs or the messages, you likely log into a patient portal, correct?
Mhm.
Like a My Chart, and it's okay, user experience okay, but you get the information you need. None of your other healthcare is there. It's just that part of your hospital
Right.
system. So what we did is we invested the millions of dollars into a world class electronic health system, Athena. So this is great. Our docs and care advocates communicate to each other, and we're connected to over 600,000 doctors in the United States. So
Mhm.
we're getting a lot of brick and mortar communication. So that's all fantastic. And it's good because everyone could probably pay the money and do that. It's a lot of work. What we did that was different is we said, actually, we're going to bifurcate the My Chart.
Mhm.
So our engineers spent a considerable hundreds and hundreds, maybe thousands of hours building their own connection from Athena to our one platform. So now when you go to your included health app, you not only see your labs and messages from your doctor in a pretty nice user experience, but then also your messages from your care advocate, your question
Mhm.
about your claims. All of it is in one place, as opposed to you kind of clicking to get somewhere else. It's just that little bit that makes it seamless for you that took a lot of work. And that's where we're putting all our chips. We think that little bit is going to be transformative.
So another huge topic that's been coming up a lot this year, maybe not a trend in the employer space, but a trend in healthcare is AI. Are you using it? How are you using it?
Yes, we are. Our approach actually is AI plus EQ. So let me share a little bit what that means. What I see in the industry is almost AI for AI's sake. Uh, and our view is we are solely focused on the member experience and taking that friction away. And then when we look at that, we say, well, where can we do that better with technology? And where do we really want that human connection to be? And then we build our product and services around that. So an example of AI plus EQ is if you have a question about your coverage, we have actually our AI chatbot Dot who answers it incredibly fast and incredibly accurately. So this is a way that we're delivering more member centricity to you. But say you're actually working through a very complex care case and you want and you need to have someone to talk to. That's where our care and case management, you are actually talking to a multidisciplinary team. They're helping guide you through that. And the beauty of this approach is it's perfectly melded. So you're interacting with, say, our AI chatbot, and then you're quickly, if you want, you could talk to the human right there as
Mhm.
well. So we have that empathy built in throughout. And that's really our approach, as opposed to what we see other approaches is solving a different problem. So I would actually say AI is a tool to solve a problem. If your problem is reducing labor costs, then you're going to use AI differently. If
Mhm.
your approach is just having a broad base, low engagement tool, then that is a different AI solution. ours is solely on the member experience. So we build around that.
Yeah, it's amazing the experiences you can build when you put the experience at the center of the whole operation. If you keep executing as you have been and you execute perfectly over the next couple of years, what would that success look like for Included?
Our mission is really to think about this third way of healthcare. So this might be a different take on what success looks like. Is if we actually change the healthcare industry to our way of approaching it, which is this ultimate member centricity and integration. So it doesn't have to be, I know we're as a company, we want to continue to succeed and we will, but if we develop that narrative and actually other people realize how important it is and we're able to be the catalyst across the healthcare industry, what that means is more Americans are going to get better care. And that's all actually we care about. We think the healthcare system is broken and we want to fix it. So that's our ultimate goal. And the way we think we're going to continue to do that is focus on member experience, focus on integration, and start finding more partners like CalPERS who are willing to say, let's change the way contracting works. Let's move out from this transactional check the box way. And let's just say we're ready. We're ready to jump in, be on the hook for costs and outcomes. And more of those will be in our future.
Well, I'm looking forward to following along here. I know, not sure what you can share, but your name's been getting tossed around a lot as far as potential IPOs, which is another big milestone for a lot of companies. Anything you can share on that front? Is that on the roadmap, or will you just take it as it comes?
When we think about our roadmap, it just goes back to our clients and moving into a model where we're able to be accountable for their total health and then being more and more part of member experience. And I don't say that as almost as a dodge. It really, I keep on going back to this relentless focus on the member experience. What we've seen in the past is everything kind of works out if you have that focus. Like you
Mm.
actually end up having better quality outcomes and reduce costs. So we're just going to double and triple down on that and continue to grow and then see where that takes us.
Fantastic. Well, Ankoor, it's been great talking with you today. I learned a ton about the company, and it really shines through the member centricity. Like I said, it really shines through how much you guys care about that, value that, and put that at the center. So, thank you for sharing that with us, and thanks for coming on the show.
No, thank you for having me.
All right, everyone, this has been the Digital Health Wire Show. Thanks for tuning in, and we will see you next time.